Hi and welcome to episode 4 of Holistic Stroke Solutions, where we're going to challenge what you are doing to regain balance after a stroke, and most likely you have been doing the wrong things. That is what this episode is about. My name is Arjan Kuipers, clinician, neuroscientist with a specialization in stroke rehabilitation. I do this together with Linda Raderstad, who suffered a severe stroke herself, is now an author and inventor for other stroke survivors. In this episode, which is part 1 of regaining balance after stroke, we're going to challenge the ways you are balancing after a stroke. We're going to revisit the previous episode, talking about center of pressure, limits of stability, what happens after the different types of stroke, but most importantly, why you probably have been training the wrong way and how we can correct this. And then we're going to talk about what other things need to be done as well, and a reference to where you can find all of this information. Welcome back. Now, we introduced center of pressure and limit of stability in the previous episode. Let's revisit that to refresh your mind and also to teach you a little bit of how things work. With me I have Superman, and he's going to be the model to demonstrate what happens with balance and the changes in center of pressure and limits of stability. So, the last time I introduced whatever happens with the brain, whatever happens with after a stroke, it will have an effect on balance. Just like anything that happens in the brain for another reason will have an effect on your walking capacity, on how you walk, on how you maintain your balance. Normally, ideally, you put your pressure exactly in between your legs, in between the two, we call that medial malleoli, the two parts from your tibia that stick out on the inside of your ankle. And this gives you that you can move in all directions safely. So there's no point where you feel unsafe, because you can lean forward, to the side, backwards, and it will you have like equal distance to the limits of stability. So imagine a circle around yourself. This is the center where you put your pressure, ideally. And this circle, which is the limits of stability, depicts where you will lose your balance and you will actually start to fall and have to step to correct yourself. And that whether that's to the side where you catch yourself, or whether that's to the back that you have to step backwards. Now, this point where you put your pressure, this center of pressure, will shift either forwards, to the side, most likely to the back and to the side, when you suffered a stroke. More on that later. So the reality is that almost no stroke survivor will have a center of pressure that is in between the two ankles, where it should be. So that immediately means that whether it has shifted to the side, or whether it has shifted forward or backwards, that where the shift occurred, so the center of pressure is more in front, then you're closer to the limit of stability. Remember the imaginary circle around yourself. So you're closer to the point where you have to correct yourself. Now, that is a problem after a stroke, because it is more difficult to correct yourself, because you have hemiplegia or hemiparesis, so you have weakness on one side, and you will actually, when you have to correct yourself, there's a big chance of you falling. So the chance of you falling increases, and we don't want that. Falls are not good in any case, but especially after a stroke, that's not what you want. So we have to address this. And this is where things go wrong. Most balance training after stroke does not specifically address where you put yourself, where the shift of your center of pressure has occurred. And that's why I want to start in this part 1 of retraining balance after a stroke, learning how we can address that. But before I do that, I have to explain what happens in the different types of stroke. In the previous episode, I already introduced that the most common type of stroke is a middle cerebral artery stroke, either on the right side or on the left side. What I didn't tell you, or maybe not clear enough, is that whenever you have a stroke on the right side, it will affect balance more, unless you have shifted functions in the brain, than when you have a stroke on the left side. Why is that? You have to understand that the right brain, all hemispheres have specialization of tasks. The right brain is more specialized in spatial awareness. It has the whole picture of your body, both not only left but also the right side. It deals with big muscle activities to keep you upright. Your spatial orientation is mostly based in the right brain, whereas the attention to details is more focused in the left brain. So, when you have suffered a stroke in your right brain, which is most likely somewhere in the territory of the right middle cerebral artery, you will experience balance problems to whatever extent, and that really depends on how much problems you have with your legs, with the weakness in your legs, how well you were trained in the past, how well the picture of balance has been formed in your brain. So you're more lucky when you have done a lot of gymnastics and your spatial awareness is really well integrated into your system. But in large, if you suffered a right cerebral artery, middle cerebral artery stroke, you will have more balance problems. In fact, you will have very strong chance that you shift away from the affected side because you want stability on your stance leg. So the right leg is still intact, you want to put pressure on there. You also start to, it's very likely that you start to a certain extent neglect the left side, which promotes this shift to the right side even more. Now, in addition to that, you shift onto the good leg, you will also have a shift in that you put yourself backwards and to one of the sides. So what you will see if we measure the center of pressure, we will see it is backwards, and it is either to the right side or it is to the left side. So the chance of you falling when you step backwards or something happens and you suddenly turn into that side is greatly increased to the back and to one of the sides. Now, there is a way to find that out, but before I talk about that, we're going to talk about what happens when the left side, your left hemisphere, is affected. You will almost always not only lean on the left leg a little bit more, but you will also experience a shift backwards. So the center of pressure is not in between the legs anymore, it will go backwards. Very likely it will either shift to the right or a little bit to the left. Later we're going to find out how you can find out in a safe way. That's the big disclaimer in this episode. Anything I tell you, you have to, if you want to do or find out, you apply it with someone else there, either your caretaker, either a professional. Be very aware. I'm not responsible if you fall. I'm just making you aware that there's a bigger chance of falling and how you can retrain this. So, right brain, more balance problems, left brain affected, less balance problems. Now, that is the middle cerebral artery, which is typically the most common of all strokes by a far margin. Now, if you have a stroke lower down with the brainstem or the cerebellum, which are greatly involved in balance perception and correction, you will typically see that you have a shift of your center of pressure forwards. So you start to shift forward. And that means that if you are going to do things, for example, in the garden, or you want to pick something up, that there is a chance that you might not be able to correct yourself because you're already standing on the limit of stability. And typically, most people that did not have a stroke but had a brain injury or getting older will experience that their center of pressure shifts usually a little bit backwards or forward, depending on where most degeneration in the central nervous system is when you get older. That does not have to happen necessarily, depends on your activities. But with a cerebellar stroke, you have to remember the shifts are forward and not backwards. With middle cerebral artery, or we call it supratentorial strokes, they are more backwards and to the side. Now, what can you do? How can you find this out? And again, if you want to find out, you may actually know. We hear a lot of our clients in the intensive trainings, but also with Linda herself, that they typically experience when they move to one side, they feel unsafe and they will not do that. And you find this out by, for example, having someone, if you sit or if you stand, and again, make sure that you are in a safe position. You can find out by, for example, closing the eyes. Yeah, and again, you have to be in a safe environment where you can hold on to something, or someone has the arms around your shoulders without touching you. And you will notice that you feel a shift towards one side. That can be purely to the back, purely to the front, or more to one side, or slightly diagonally backwards. And if you feel you're standing pretty stable and someone challenges you, for example, to the right side or to the left side, or diagonally left to the back, and you notice that every direction feels pretty stable except when someone is challenging you here, it feels unsafe, then you know you have shifted back from the middle to the back. This is where you're already standing close to the limits of stability, where you can or have more difficulties controlling yourself. So you will feel being challenged into this side. It feels more dangerous to you. You have found where your center of pressure has shifted. Now remember this doesn't change that easily, and I'm going to tell you a little story. A couple of months ago, I was explaining this concept to our trainers at depth. And Linda was listening to me, and we have not really looked into this with Linda as such, but in some situations we know that Linda can be a little bit more unbalanced, even if she's pretty balanced after a stroke because of all the training she's doing. So her ability to correct herself, the speed at which she catches herself, is pretty good, which is an important factor, but also we will discuss this in part 2 or 3. And her strength in her leg and arm are pretty good, especially her leg can react very quickly. And of course, if you have a lot of spasticity and you have no capacity to lift your foot, for example, or have poor hamstring strength or buttock strength, this will mean that you cannot correct yourself on time, and that is another factor that we will discuss in another episode. But in this episode, we're going to talk how can we retrain the center of pressure back. Now, Linda wanted to know how this worked, because I told something that is completely counterintuitive, and exactly why I told you at the beginning of this episode, why you probably have been training balance wrong. Now, don't get me wrong, you probably have been training balance in general with general balance exercise that will actually increase your speed of reaction, increase your strength to react to perturbations of your balance, which is good because it takes you further away from falling. But what it doesn't challenge is that shift in center of pressure. Now with Linda, when I pulled her with the eyes closed a little bit to the left and back, she would almost fall and have to correct herself. So that was her shift of center of pressure, was to the left and back. And now comes the really interesting part. In contrast to what most of you have been taught and what most professionals have been taught, and that's why I was teaching my trainers how to think different about this. Normally you would say, okay, you have shifted, your center of pressure is back, which makes it more dangerous to the left and back, or whether that's in front or to the side, doesn't matter. So we are going to train you away from there. So we are going to train in the opposite direction. Well, I can promise you what your body has already done, and this is one of the reasons why older people put themselves forward in a so-called camptocormic posture. They perceive that it is dangerous to go to the back, and their body will react by contracting the muscles on the side and constantly reminding you that going to the back is dangerous. Now, what I did with Linda, and this is probably the best example that I can give you, if you wonder how quickly you can change the perception of your brain of where you're supposed to stand, you actually have to train into the weak side, completely counterintuitive. What I did with Linda, to just show her how quickly your brain and whole body responds, and again, Linda is already further in the training process than most of you are, so that went very quickly. We started to have her push into the weak side. So she had to resist that I was pressing her. I was pressing and she was leaning into the weak side, putting pressure and using her muscles to move into the weak side. And you can do this by stepping into the weak side. If the weak side is in front, you step forward, or you step forward to the back, for example, when you have a problem with your brainstem or cerebellum. And in Linda's case, she could step backwards or turn into this side. And you can do this sitting, you can do this standing, but again, always do this when someone is present, unless you're sitting and completely safe and feel that you're safe. You can do it with a resistance band. So you can have someone have a resistance band around it and have them lean into the weak side. Everything to increase the awareness of the central nervous system and the brain that this is the direction where you want to have increased perception. You want to be more aware of your weakness. What happened in Linda's case is that within 2 minutes of doing these exercises, she was rock solid. There was no more chance of falling to her because her center of pressure shifted immediately here. Now, you cannot fix this in one go. It's like with all the other exercise routines after stroke. You have to repeat this over and over again, so you train your brain so it becomes so neuroplastic in awareness that you never have to train it again. Typically, if you don't train it again after one session, it will gradually shift back. This is a hugely important concept. When you want to really address your balance issues and the chance of you falling, we have to shift the center of pressure back to the middle, to the center. In the notes under the video, I have a reference to a blog post where I go step by step through everything I told you in this video, so you can start retraining your center of pressure in the home situation. Now, in future episodes, we're going to go into retraining the speed at which you catch yourself, and also how your leg, ankle and hip mechanisms can be trained to catch yourselves quicker. Hope to see you in the next episode. If you have not done so, please subscribe to this channel. See you in the next episode.